My micro-preemie spent 87 days in NICU. When discharged, I had so many questions in mind, and the main goal was to find the right pediatrician for my son. Today, I'm so excited to interview an especially caring and knowledgeable pediatrician, Dr. Yekaterina Belousov. I'm so grateful to her that she helped me to gain confidence in taking care of my baby. Next question is about activities. I remember back in time you recommended me to enroll Michael in swimming as soon as possible, and at that time he was 7 or 8 months old, and I'm so thankful for this advice. I started with Michael right away, and he just loved the water, and I saw how, I saw overall well-being. He slept better, he ate better, and I think that's really helped for his muscle tone, for his core muscle development. Please, can you elaborate on this swimming benefits for babies, and maybe any other activities that you can recommend can be useful?
Yes, certainly. With swimming, it's very unique because it's in water and they're having this movement where they're moving their hands and kicking their legs, and just that coordinated movement actually helps lay down different nerve pathways in the brain, and it almost kind of, in a way, helps different parts of the brain communicate better. And I do find that it helps with, like you said, muscle tone and even coordination, where they're like figuring out, like, what do I have to do to stay afloat? But it also, just from a social development, they're learning with usually a swim instructor or a parent, and there's that bonding going on, and they're also learning to trust someone else, and even just it turns into a play activity, and it's just, I find that it's a really helpful activity. And then, like, you and I live in sunny Florida, and we're surrounded by water, so just as a safety as well for children under 4 years of age, drowning is one of the leading causes of death in children. So that's something I really stress for parents, is just, it's great for their development, but also for as a safety, just to have them learn how to stay afloat if they get around water.
Thank you. Any other activities, like should we try massage, or it's very popular now to take babies to music classes, or something else that can be beneficial from medical point of view?
Yeah, so there are different studies out there. I saw some even just playing like it was classical music, or like an instrument that they played actually in NICU for babies in, I think it was Switzerland. And so they found like that pleasant coordinated sound that was strung together was very good for relaxing the babies. They even were suggesting that there was some help with the development later on. And just in that the baby hears all this sounds of the alarms in the NICU, and doors slamming and whatnot, just not very pleasant sounds, and then they listen to coordinated, pleasant music that is helpful. But then as they get older, musical instruments and just experimenting with it, it helps with their development. The whole cause and effect, where they press the button or like a key on the keyboard, and they hear the sound that they're able to produce. Or they tap a drum and they hear the sound that they're producing. So those also involve motor development as well. And then with massage, I know you and I are Eastern European, right? So it's very popular to have infant massage, and it is like a way for the baby to relax, can help their muscle tone. And it's a way also, just the touch is so crucial for babies, for development, to feel that connectedness and for development. So I definitely think that it's helpful for sure.
From your experience as a pediatrician, what common problems do you see with preemies and especially with micro preemies? Chronic medical problems, developmental delay, behavioral issues, any of those?
So there are a lot of common issues that I will see that premature babies will have to overcome, depending especially on how premature they were. A lot of them will have problems with their lungs, with respiratory issues, because their lungs didn't have time to fully develop before they were born. And some of them will have to have oxygen. I believe Michael had to have the tube down, right, where the breathing machine, yes, was breathing for him. And then depending on how affected they are, some are going home even with oxygen. And then fortunately, most of them, as time goes on, they develop and that improves. But some of them end up then having higher risk for asthma and other conditions of their lungs because of being premature. And then we kind of touched on the reflux and the digestive system being a bit more sensitive. Some children will have the brain bleeds, and fortunately, most of the smaller ones will resolve and not be an issue, but some that are bigger, they will affect the child's development long term then as well. And then a lot of them will have, their eyes will not be as developed, and especially the retina, and they are following with an eye specialist until that either just matures on its own and resolves, or some do need intervention as well. And then more chronically, some children will get cerebral palsy, which is a condition in movement and coordination and muscle tone. And so then we're looking at long-term therapies and working with them for that, and sometimes needing to do muscle relaxing medications. And with behavior, from my experience, a lot of it, I've seen the babies that were premature maybe didn't do as well in NICU. They were having a lot of episodes where they were stopped breathing, decreased oxygen to their brain and whatnot. I've seen that affect then their behavior as they got older. And then there is also some correlation with NICU babies and having attention deficit disorder and attention deficit hyperactive disorder. So those are common things that I see. But there are some that have a rough NICU course, and then they develop and catch up to their peers, and they do very well. So there's a big spectrum of what we see.
That's exactly, you led to my next question about catching up on developmental milestones. By what age usually do you see preemies catching up with the peers?
So the expectation is by 2 years of age. And yes. So as a pediatrician, we do an
That's
adjusted...
not my case. That
No.
was not our case.
And well, Michael was very premature. He was 25 weeks,
25.
was it? Yes. So, and I really take into consideration the adjusted age. It's subtracting out when they were due and how early they came, and really adjusting for that. And then when I'm seeing the baby in the office, and each visit where there's certain milestones that we're expecting them to be meeting, I keep in mind, okay, this baby is maybe 4 months, but they're really they should only be meeting 1 month milestones because of how premature they were. So taking that into account, and I do find that for a lot of children, therapy ends up being a huge help. Just having other professionals come around and help the parents to really engage the child and really help challenge them and to overcome those hurdles, because it's true. I watched that video that you put up with Michael's journey from 25 weeks to 5 years. That's such a beautiful video. And it's just incredible to see you had a whole team of people come around you to really support. And it's amazing how far he's come. It's really amazing.
Yeah, that's the team that's hard to find. It's like I can describe as a village, you know. It takes a village to raise a child, and I found my village. It was not an easy journey, and sometimes I changed therapist if I saw that therapist was not good fit for my child, and I was looking and educating myself and trying to see around what other traditional and non-traditional therapies that my child can benefit.
Yeah. You're a great example of like a mother who is an advocate for her child, but it's incredible. I feel like when that's the challenge when you have a child who's a NICU graduate, you have a lot more on your plate, and then it's just being an advocate and getting your child the therapies that they need, the medical care that they need, and you are an example of a mom who is doing it so well. I really commend you on that.
Thank you. And my last question, it's a tricky one, I think. I'm not sure if we'll know truth for sure, 100%, but I still want to ask you your opinions and your knowledge. Preemies, especially micro preemies, tiny, behind his peers in weight and height. And when do you think they will catch up? I'm asking this question because me and my husband are tall, and Michael is almost 6, and he's still pretty short, less than average, comparing to his peers the same age. And I know that a lot of parents on Facebook groups that I found ask the same question. They just ask other parents from their perspective and knowledge, and some parents decided to go further and do hormone, it calls growth hormone injections. And some parents just wait and see, they don't bother it, especially for girls. But I want the best for my child, and he's a boy. I want him to be as tall as possible per genetics, of course, not like something, but I really don't want prematurity to affect genetics, and to know if I can do something or just not.
Yes, that's a great question. I've been looking at the different studies that are out there, and there is some earlier ones that were suggesting that, yes, there's a lot of effect of being premature, and especially very low birth weight and very premature having a significant effect on height as an adult. But then more recently, it looks like, depending on what group they look at, I saw one saying that 80% of children who were looked at in that study who were premature, actually by 18 years of age, were at an expected height compared to their full-term born other children that were born full-term. So but then, yes, there is that subset of children, especially what I find is the ones that were very premature and very low birth weight, and also had a rough first few years, that they had a lot of medical problems. They were not getting as good optimal nutrition. They were very anemic, so that decreases the amount of oxygen that the different parts of the body is receiving. So it's very, I would say it's a complex question because there's so many factors that play into it, and it's hard to say, especially in those first years, because we actually will plot the premature baby's weight and height and head circumference on a different chart that's for premature babies. So we don't want them to be like way below what is expected for a full term, because we take into account that they were born early. And so that chart usually is for the first 2 years. And initially we were told by 2 years of age, by 3 years of age, they should have catch-up growth. And I do see that in and actually most of the premature, they kind of start going on this almost like faster growth and weight gain trajectory. And some studies now are saying, no, it's actually longer. It might take more than 3 years for that catch-up growth to happen. And then the whole growth hormone discussion, it's one of those things too. It's a therapy that has risks and benefits associated to it. And I believe that around 7 or 8 years of age is where the endocrinologist is the specialist who will do those therapies, can then evaluate and decide, is this a good therapy for the child? But then too, it's like, deciding, do we want the height? And, we could potentially see the side effects that can come with that. So it's really that discussion of whether it's worth pursuing for those reasons.
Thank you very much, Dr. Belousov. Appreciate your time today educating me and other parents. I know that you have your own YouTube channel. Can you please tell us about it?
Yes, I have a YouTube channel called Friendly Kid Doc. I had an opportunity to record some of my friends' babies and make developmental videos. I had a lot of parents and a lot of friends approaching me and asking me what milestones should we be expecting our babies to meet at different month marks, and what activities can we do to stimulate and encourage the development. And I will be honest, they're geared more towards a full-term baby, so not like a micro preemie. But if you are adjusting their age, it's still relevant. And then I went on further to do some feeding videos. I have a lot of parents interested in baby-led weaning, so I touch on that. And then, of course, there too with premature babies, we're adjusting for their age for when we're starting solids and whatnot, and taking into account their development. But I just wanted it to be a resource for parents where they can, whenever they need that information, they can log on, watch the 5 to 8 minute video, and get some insight that they can apply towards taking care of their child.
Thank you very much, Doctor.
Yes, thank you.
Thank you for today's interview. It was great.
My pleasure.